Hey, Mr. Ruger, it looks like your physician placed your discharge paperwork, so it looks like you're going home today. I'm just going to educate you on this medication we're sending you home on. It's called Epoetin alfa, also known as Procrit. As you know, you're a little bit anemic due to your chemotherapy treatment for your cancer. That's why we're using this medication. Your hemoglobin levels are around an 8. We like to see it between 12.4 and 17.4 grams per deciliter in males. So what this means is your hemoglobin is a protein that binds to oxygen, which transports your oxygen throughout your body. And yours is low, so as you've seen, you have a lower, you're having a hard time keeping your oxygen levels elevated. This medication is going to increase your hemoglobin levels, making it a little bit easier for you to carry that oxygen throughout your body. The way this medication works is it's going to act on your bone marrow, which is the site of red blood cell production. So that's going to increase your red blood cell production, which your red blood cells carry that hemoglobin on it, and the hemoglobin carries the oxygen. So we're going to get that oxygen a little bit higher. So your physician placed an order for your dosing, which a common dosing for this medication is going to be 150 units per kilogram. So for you, your dosing amount is 4,090 units. This is a subcutaneous injection. All this means is we're going to insert it into a fatty area like your abdomen or the back of your arm. It's important that when you administer this medication to not shake the vial. You just want to pinch the area that you're going to insert it at, like your abdomen. Make sure it is further than 2 inches away from your umbilicus, not within the 2 inches, or the back of your arm. Wipe it down with an alcohol wipe. Insert the injection into that fatty area when you pinch it to gather up more fatty tissue. You also want to monitor your blood pressure before and after administering this medication because it can cause extreme hypertension. So if you notice your blood pressure like skyrockets, that's a bad sign and you want to contact your physician. So some adverse reactions. We also want to make sure we take this 3 times a week. So subcutaneous injection 3 times a week, 4,090 units for you. That's your dose. Common adverse effects for this medication would be headache, dizziness. Those are common. And then some signs that we want to look out for to notify the physician or to call 911. It's going to be a deep vein thrombosis. And so signs of this, you'll be able to pinpoint where this is because it's going to be red, swollen, painful, usually on your extremities. These are very emergent because they can travel. So it can also cause a pulmonary embolism, which you'd have shortness of breath from this. It can cause a stroke. Signs of a stroke are going to be facial drooping on one side, slurred speech, and one-sided weakness. They can also cause heart attacks. So if you have that severe chest pain, and this medication can also cause seizures. These are emergent situations where you want to notify the physician, or if something's happening like a DVT, pulmonary embolism, you feel like you're having a heart attack, or a stroke, you want to call 911 to get that medical attention immediately. So it's also very important that you go to your follow-up appointments. You have a follow-up appointment next Tuesday. I'll give you a piece of paper with the address, date, and time so you don't forget. It's important that you keep this so we can monitor your labs. If your hemoglobin goes up too quickly, this can cause worse adverse effects. Your hemoglobin could be going up way too quick, and we might need to either stop the medication or adjust your dosage a little bit. Do you have any questions? No? Okay.